Namaste, dear ones. Thank you. While we are getting technologically set up, and Dr. Prashant is joining us very soon, getting himself set up properly as well. Coming to sit up straight. Relax the shoulders. Relax the jaw. Relax the cheeks. Just bringing all your attention into the third eye. Deep inhale. Extra long exhale. Deep inhale. Extra long exhale. Bring palms in Namaskar Mudra for 3 Oms together. Inhale. Inhale deeply. Proud inhale together. Namaste. Namaste to the fellow Ayurveda enthusiasts on the screen today. I just wanted to chat a little bit about why we are here today while Dr. Prashantji is. Saurav, are you speaking to Dr. Prashantji and helping him get in? Saurav, Palak, are you guys there?
Yes, we are. We're just getting, yeah.
Sure. So I think he needs a little bit of help to get in. So someone is helping him, please. Good. So while he's getting in, I wanted to share a little bit about why we're here today. Dr. Prashantji is the head of Akhanda Ayurveda. And for many of you, you've already met him on last month's, I think we had a chat on Ayurveda. Namaste, Dr. Prashantji, you're here.
Namaste. I'm audible to you.
We can hear you. Hold on. And can you guys all see both of us? That's okay.
Yeah, I'm a little sorry for joining you late because of the Guru Purnima. My all students from different places came here, so I'm so sorry for joining 5 minutes late.
Okay, nice. Can you all see both of us? What can you see? Oh, okay. Hold on, wait. Let's see if we... Can you see both of us now? You can't see both of us now?
No, we can't see.
Multi-speaker setting. Okay. Can you see
On the
both of us
right-hand
now?
side, yeah.
Can you?
Yeah,
Yes?
I can
Good.
see both of.
I can see the both of you, and everyone can choose the setting in their.
Yeah. Everyone can choose the multi-speaker setting on the
Yes.
right-hand side of the screen.
Okay. So Saurav and Palak, you will manage that and help everyone while we get on with the conversation.
Yeah.
Okay, so namaste everyone, and namaste and big welcome to Dr. Prashant ji as well. I was just about to start sharing about why we're here today. Recently, I think in February this year, March this year, we had some time at the Jungle Ashram where a group of you came and you did an Ayurveda treatment and a course and experienced the first time of Ayurveda treatment at Jungle Ashram, which was a whole special gig in itself, trying to figure out how to bring steam boxes and things up into rooms and how do we manage that at the Jungle Ashram. And a lot of things came up around women's well-being. A lot of things came up around how is it that during particular phases of life, women are experiencing some common things, some similar experiences, and also very unique experiences, but some similar experiences in the body, in the mind, in their sleep, in what their system is doing with different types of foods and different interactions. So we really wanted to ask very specifically for women who are not necessarily always having time and energy to take care of themselves in a modern lifestyle where you're not living in an ashram and someone is doing all the cooking for you. How do we go about doing that? So we asked Dr. Prashant ji to do a full workshop focused on just that. And so he's here today. For those of you who haven't met him, he's head of Akhanda Ayurveda now, but he has a very illustrious background. He's a gold medalist in Ayurveda. Firstly, so this is very nice. He is in his degrees and qualifications, he's excelled muchly. And he told me that he was planning to initially be a medical doctor, or he was, I think you were encouraged to be a medical doctor, a Western medical allopathic doctor. And then you actively chose to become an Ayurvedic doctor instead. Can you tell us a little bit about that story, Dr. Prashantji?
Okay, thank you, and namaste everyone. And actually, in 2003, I got selected for the Western as a medical Western doctor, and I have started my MBBS for 4 days. And after that, I don't know how I realized that I should go to Pune and explore more. And when I reached there, and I found that Ayurveda is having some different dimension and understanding towards the life sciences. So it actually made me like more interested to understand that science. But when I start understanding that, so I was not able to find out the way how it is written in Ayurveda. So I met my Guruji, Vaidya Vilas Namakji, and he told me like the understanding of the Ayurveda is from macro level, from the environmental level to the micro level, and basic medical science is working on the cellular level to the human level. So that was the basic difference, and that life changed in that way. Then I went back and I cancelled my modern science course, and then I opt for Ayurveda. And um, after that, I did whole my BMS, MD, PhD in that way only. So that was the journey to understand the macro level to the micro level, as well as the beautiful science of 5 elements in which we can heal everybody, including not only human, including the animals, including the plant, everything. So for the every living being, it is having the common solution and common way in Ayurveda. So that wonders me, and that actually made me more interested. My voice is clear. I'm audible properly.
Yeah, I think so. For the most part, I can hear you. Can everyone else hear him? Yep, good. We can hear you. Yes, yes. Thank you. So at the moment, Dr. Prashant ji is a global traveler. He's travels between Korea and India. And if we can share a little bit about your work in Korea, because it's very fascinating, this work of Ayurveda and integrative medicine in mainstream hospitals. Can you share a little bit about that as well?
Yes, thank you so much. Actually, 2016, we have started the work in Korea in 2016. That time, nobody in Korea knew about Ayurveda. They heard about Ayurveda somehow, but they do not know the exactly how Ayurveda is working. So when I met Dr. Bond there, so one of the oncologists, he said, actually, I don't believe that Ayurveda will work for any oncology patient. What we can do, it's a complementary treatment. So we will allow you one place outside the hospital in which you can apply the oil and you can do some aromatherapy, like kind of things. He was only interested in that portion, that only aromatherapy can help and such kind of oil can relax my cancer patient to some extent. So we took it as challenge and we started the not aromatherapy as a proper Ayurveda treatment. And we have introduced Ayurveda treatment in terms of external therapies in cancer patient in 2016. Then we started in some patient and some patient give the feedback to the oncologist that because of this treatment, we got so much results in our insomnia, body ache, and the discoloration in the body, which was the side effect of the chemotherapy. And we was facing it, but after taking this therapy and such kind of oil treatment, we are getting so much result in our insomnia, especially. We was not able to sleep, abdominal pain, all joint pain, body discoloration. It was turning to black, and now the body is turning and it is glowing, and luster is coming. Hair fall is reduced now. So such kind of 16 symptoms, they said that it is reducing. So then, after 3 years, Dr. Vaughan and the team said, now you can ship inside the hospital because it is considering as a scientific way and people are getting so much result out of it. So we have started with two Panchkarma unit there, and we have started the all Panchkarma treatment external way, including Nasya, Shirodhara, and many things altogether. So in this journey, we have done the Panchkarma treatment over 12,000 patients there, and they found that actually now people are saying we don't want to take chemotherapy, we don't want to do anything, we just want to follow the five-element theory system, Panchkarma, and by which we are getting so much result in our cancer situation. One day, what happened? One of the patient who was having the fourth grade of lung cancer, she start taking and understanding the Ayurveda lifestyle also. That was the how to start the day, how to do the daily rituals, only putting the nasal treatment in the nasal root, and how to apply oil by herself every day, and by doing small rituals. And after 6 months, she came and she said to the oncologist that, ma'am, sir, actually, I'm not feeling any illness now, though my body is showing some symptoms of cancer, but actually, I am feeling so fit. But that time, oncologist was not interested in her story. He said actually it is not evidence. There is no evidence that you get cured by Ayurveda in this. But she continued that, and in 2 years, she found that the cancer level is not growing and everything is converting in a very good way. So by seeing her, almost 50 patients start coming and they said, no, we want to take Ayurveda and we want to experience Ayurveda and we want to do the rituals. One of the area near to that hospital, it turns into resort, and people are staying there and they want to follow the Ayurveda rituals in that way and follow the Ayurveda lifestyle. So almost 50 patients start living there, and one parallel group started there. So they got fascinated and they said why the Ayurveda is working so well. So now one of the scientists who came there and he found that the Ayurveda is actually working. So he asked me that we should do some kind of research on the dementia and Alzheimer's to understand how Ayurveda is working. So we did one pilot project and we checked the biomarker initial and final, And we found that in 5 patients, people are actually the dementia is not increasing, and though the some symptoms are reducing also. So now we are doing the research on dementia in South Korea in that particular hospital with the Gwangju Institute of Science and Technology. So scientists and Ayurveda doctors and neurology department working all together. Now we are doing the research on it. So that was because of the initial that only Abhyanga treatment. Now it is into the actual authentic research in which 3 institutions are involved. And we have done almost 12,000 patients who are taking the cancer palliative care with the help of Ayurveda. So that was the journey till now in South Korea. We are still working in till 2028. We are having legal MOU there. So maybe it will go well more than that.
So we have seen Dr. Prashant Ji's level of energy in action. As you guys know, I'm not an active adherent to Ayurvedic principles. I love food of all kinds at all times. And so the first thing that I was excited by was Dr. Prashant's favorite drink is a mocha. And if you know me, you know why that was really important. And separately, though, I also observed him traveling between Korea, Delhi, ashram, jungle ashram, back, and he always looks pretty much the same. And so I thought he must be onto something, because somehow between all that energy use, his energy doesn't really fluctuate. And so we will come back to talking about you, Dr. Prashantji. We actually, on this topic of Korea and Ayurveda in Korea, because in India, when we speak about Ayurveda, we often talk about herbs and things that you're like, oh, it's just here or it's just there. And then you come overseas and you're like, no, it's not just there. I can't just buy it in my local grocery store. Do you guys have that experience? Right? They've said all these things that seem so simple while you're in India, and then you come back overseas and they're like, okay, no, actually, I can't find that. And the local, if there's a spice store or something like that, they don't stock that. And I imagine Korea is kind of like this. I don't imagine they have all Ayurvedic traditional herbs. And Guruji and I were watching a documentary the other day on Korea. Some of you maybe have been to Korea. Anyone here been to Korea before? Kind of, no one. So we were watching this documentary that they take your weight, your, I guess, the level of fat you have on your body very seriously, right? So people like us would be considered extremely fat in Korea. And so we thought, so it's a completely different environment, dietary environment, lifestyle environment to being in India. And yet, starting from aromatherapy to where you are sharing about now, in a space as serious as oncology. So it's not a small space. Space of cancer, advanced cancer treatment is not a small space. So you must be doing something very well. And we are looking forward to visiting Korea after we lose a bit of weight so that they don't fat shame us. So, Hariom. We wanted to have, we have a number of, I'm sure many people have questions here. But I thought I would start with, I'm sure you have a prepared, as a scope of coverage you want to cover with us today. But I wanted to ask you on something which I've observed in many women, specifically, after a particular kind of maybe like late 30s, early 40s, around a topic of inflammation. I'm going to start on inflammation because it's everywhere on YouTube. A lot of people are talking about how they can tell you to fix it. Some of it looks a little dubious. Is this something that is talked about in Ayurveda, and is it connected to an age, a space, a particular body, dosha type? Can you share a little bit on inflammation?
Yes, it's a very interesting part, as well as not only on the late 30s. If we say inflammation is every time, it is evident. In early ages also, in the early ages like 16 also, people have having different kind of inflammation. Now you can see many patients are having the polycystic ovarian disorder, perimenopausal initiation, and in the late 30s. But sometime the initial, when the period started, then also the inflammation is very high. Mood swings are very high. So that time, actually, Ayurveda is working on the three elements only, three element system, Vata, Pitta, and Kapha. So these are the three elements in which we have to understand the disturbance. When inflammation is there, it is a disturbance of Pitta and Vata altogether. When swelling is there in the body, then Kapha is actually vitiated or disturbed. When only swelling is there. But when inflammation is only there, then Pitta and Vata elements are like inflamed or they are disturbed. So how to understand in an easy way and in day-to-day life or very easy language to understand this that Pitta is related with the factor of fire, in which the fire element of the body is very high. The fast element, the movement element, and the liquid portion of the body is increased. So a liquid portion can be the blood, can be CSF, can be the gastrointestinal juices, anything which is having the when we see all kind of liquids of the body, including your eye, like water of the eye, your saliva, anything which is liquid, when it is heating up, like when the fire factor is increased in that, so that is known as pitta prakop. Like pitta is very high on it. So when we see, suppose we are having burning in the eyes and we are getting stickiness altogether, that is also inflammation. When we find our hairs like very, like the hair fall is there and graying is so much in a higher rate. So when we say graying is very high and the hair fall is very so it's so much, then pitta prakop is in the hairs. When we see the stickiness is increased and burning is increased in the eye, it means inflammation is in the eye and it is on the external level. It means on the level of eye. When we find then, when we breathe and when we exhale, and sometimes we find that the fire, it is fire is coming and it is very heated, heat is coming out. So that means some inflammation is there in the nasal areas and upper respiratory area. When we find when tongue is so much extremely inflamed and ulceration, we can see the inflammation is in the tongue area. So that is pitta prakop. And when it is coming all together, eye is sticky, hair is falling, flushes on the like face area, as well as tongue is having ulceration, no taste is there. Then we whole all combined that pitta prakop is in this area. So in this way, we understand that inflammation is there in which part of the body. And always when inflammation, pitta prakop is there, pitta element or fire element is on the high, automatically the vayu element and the vata element is which is going to create the dryness at the same time, pain at the same time, movement and so much confusion as well as irritation and complete like rapid movement in this. So when we are inflamed and suppose eye is not working and burning, that time same time we sometimes experience pain in this area. Sometimes we experience so much irritability and we cannot concentrate. So that is a vata element of the body which is disturbed. But beautifully in Ayurveda, the vata element and pitta element, everything is having proper herbs against it. Ayurveda believes when your whatever element is disturbed, suppose fire element is disturbed, we are having the cold herbs, which is cold in nature, which is actually going to balance the fire element. When we are having the vata element, some then opposite herbs are also there. So when we find when we was actually taking out the list, how many herbs are responsible for the vata and pitta all together in inflammation. So we find out the 10 herbs which are known as dasha mula. Dasha mula means 10 means dasha and mula means the root. The roots of the 10 herbs are working very well in the case of inflammation of the body in any cases like hair fall and hair drain as well as eye inflammation, facial inflammation, and all kind of things. So that was very fascinating. I found that any kind of inflammation is very beautifully explained in Ayurveda, and that can be healed in a very specific and a beautiful way. So general treatment is also mentioned in Ayurveda so that general community and whole community can understand, and very specific and the extreme specific on the basis of the body type is also mentioned. So that is the beauty of Ayurveda. When we have to do the specific treatment, that is also mentioned. When we have to give the general treatment, that is also mentioned. So in general, we have to understand inflammation is pitta and vata disturbance only. But when we talk about some here, many people are there like Hana and Haldi Devi ji and Prem Rupa ji. Many people are there. So when somebody will come, we will analyze the body type, and on the basis of that, we'll find out which inflammation is actually happening and which quality of that pitta is disturbed. Pitta is having many qualities. Fire element, the fire segment is there. Also, movement segment is also there. Dryness and is also there. Liquid segment is also there. So this is mentioned in Ayurveda Sanskrit language. So this is like a Tikshna, Shita, Khara. In this kind of language, Sanskrit way it is mentioned. But just we have to understand on which body type, which quality is disturbed, and we give the extreme and very specific medicine for that condition. But that is very difficult to find out in the grocery and all kind of stores. That's why general line of treatment is mentioned. So when pitta is disturbed, we have to ask them for the A2 cow's ghee. So when pitta is disturbed, when vata is disturbed, sesame oil can be the generalized line of treatment. So when inflammation is coming in the mind, pitta and vata is coming, and that quality is disturbed. And we, as a Ayurveda treatment, as a Ayurveda Vaidya, we are just balancing the pitta and vata element in the body in any age group.
Beautiful. So this is a very interesting thing, right? Because I don't know a lot about the Pitta and Vata dosha types, but I imagine that many women who are holding many roles, some are very unacknowledged roles, multitasking, um, doing many different things early morning to evening, that the Pitta element and the Vata element might become easily out of balance. Is that fair to say? Do you see many women in this
Yes.
category?
No, absolutely. Women is actually the representation of Shakti as well as the strength, because only women is having that multitasking capacity. They are having all kind of emotional segments also, how to do the things also very well, how to care the all the family members, many multitasking way. When they are alone, also they are thinking about the community, their friends, and the discipline from the morning to evening. So that is a God gifted thing. That's why in Ayurveda and all the ancient texts in our Indian philosophy, it is always in Darshan Shastra they have mentioned that female segment is Shakti. Shakti means the strength of life. And Pitta and Vata element can be disturbed because of the overburden as well as multitasking. So that is, but the thing is this, that can be very much easily healed with the help of Ayurveda daily rituals. So then it is known as Dinacharya. So that is the only reason when we say in the old time, females was warrior also. She was making food also. She was taking care of the whole this areas as well as family, everything. Why they, because they are able to manage it, because they are following the Ayurveda Dinacharya very easily. So that was the thing. So when, as a physician, when I'm giving my this Dincharya things to my female patient, they are responding very fast and they are getting very good balance because they are having internal discipline inside them, and they know how to manage the things in a like very different ways, like as a mother, as a sister, as a friend, as a wife, every way they are. But men's are
And
less
that's
disciplined, which I found. So that was the reason
it's
also.
meant. Oh, I stopped him just when he was about to say something about the men. Uh, no, it's fascinating that you phrase it this way because sometimes it can feel for many women out there that having so many capabilities is more of a curse than a blessing. That they're always needing to be there for someone or do something for someone. But in your description of Shakti energy, and we've just finished a classical Kundalini yoga program, that Shakti energy is so powerful and capable that she's also able to manage it with the right support, right balance, and right, kind of structure that flows around it. And so before we open it out to some more questions, I wanted to ask also about sleep because this is a very common thing that we get asked about here at Akhanda, um, about sleep disturbances, and how to bring that back into the system. Because from sleep, I think a whole bunch of other things, including Vata and Pitta also get disturbed. So can you talk a little bit about sleep?
Oh, very, very important question. I can see that everybody is having the sleep. When we talk about the sleep, everybody want to hear that because sleep because sleep when we say it's an easy and most like natural process, the sleep should come in the night. That in Ayurveda also it's a very naturally it should come in the night, and kapha of the body should be there and we should sleep properly. But as I say, the Shakti segment is high in the case of female, but they because of the overuse of that Shakti, because for the for doing so many things, so sometimes they get exhausted also to balance. So that exhaustion lead to high level of Pitta and Vata in the body, and that leads to insomnia. One reason. Second is responsibilities. Sometimes they have to get up very early because kids have to go early in the schools. Sometimes they have to start their work, and they have to prepare the food. That's why the sleep level, and they train their mind in that way. They have to get up early. So because of that perfection and the more discipline segment and no choice segment sometimes, so the sleep is getting disturbed because of the daily pushing. Suppose they don't want to sleep at 9 o'clock in the night, but they have to sleep because they have to get up early in the 5:30, 5 o'clock, or sometime 4:30. So this kind of pushing also can create problem. But what I found, if we manage it in Ayurveda terms, suppose we are putting oil on the foot area by doing simple oilation in the foot area in the night. Suppose this kind of discipline and this kind of ritual we are adding. So first thing is this: we are balancing the kapha and we are creating the natural kapha, and we can sleep in a very sound and a better way. So small changes, and which is a part of daily ritual, because Ayurveda is nothing but a science of life. How we are changing ourselves in a scientific way, the life in a scientific way, that is simply Ayurveda. Ayur means life, and Veda means scientific implementation of that. Simple. It can be anybody's life, but in case of female, as they have some discipline and say they have some work and early morning, so early morning wake up is necessary for them. So in that case, actually, if we put the late night oilation in the foot area, simple padabhyang. Pada means foot and abhyang means oiling. Simply the application of oil in the foot area. I'm just showing the skeleton. I'm so sorry, but actually in the foot area, if we just do the oilation, simple oilation will heal your so many cells, and very like your this antioxidants level can be increased and free radical can be reduced by this oiling. Simple by sesame oil. So this simple ritual, if we add, and by Padabhyang, we can find the very beautiful sleep. In because when we read about Padabhyang in Pada means foot and Abhyang means oilation. In Ayurveda, it is very easy, and you'll find Preeti Nidrakaram Vishyam. Preeti means you will feel loved first of all by oilation. Second is Nidrakaram, it means your sleep quality will be very high. Brishyam means you will feel energetic, and your cellular level and your immunity can be increased. Simple ritual, and every female will love it. Simple oilation. If some men is also doing to their wife or to the beloved, that will be more better, and very easy way.
We need to
Simple way.
timestamp
Just
that in the YouTube, Sarah. We need to timestamp this moment. What men can do to support.
simple oilation, and that
And I
can be
love
the
that you
ritual
have
of
like a foot bone next to you to demonstrate for us. Thank you. Please continue.
So actually, when we apply oil, it is a ritual for both of them. The men should do oilation to the female foot, and that padabhyanga is preeti nidrakaram vrishyam. Preeti means the way of love and affection. Nidrakaram means the sleep should be very well, and vrishyam means the immunity and the strength of the female. As a gift, as a everyday ritual, men should also do. And if suppose somebody is single and not able to get this kind of things, so simply oilation will help you in all the three things. So padabhyang is a very beautiful way to balance the sleep.
That's such a fantastic tip. And For those of you who were in the Ayurveda program in March, I think, and maybe today, Dr. Prashant ji will kind of demonstrate how we do self-oiling. And it feels like the concept of self-care and self-love began in Ayurveda many thousands of years ago, from even the words of loving. Preeti is loving the self. Okay, do we have, Dr. Prashant ji has lots of content to go through, but I think if anyone has any questions, you can feel free to ask at this point. I think Hannah ji has a question. What type of oil, please?
Yeah. If you are having so much heat in the body, then you should apply cow's ghee simply, not oil. But if you are having the dryness in the body, dryness, then sesame oil is the best example because sesame oil can be used in all kind of body type. If you are having the dryness, if you are having body heat high, and if you are having oily skin. In all the three body types, sesame oil is the most appropriate answer from the side of Ayurveda. I'll tell you the SOPs, the standard operative procedure of this Abhyanga also. You have to do it for 15 minutes, only in one direction. Slowly, slowly you have to do towards the your fingers, and from the base you have to start. If I can show you right now also how to do, I'll try. I have to change the angle in this way. May I change the angle?
Dr. Prashant ji, before you demonstrate that, maybe in sort of middle of this workshop, anyone who has a bit of oil around can grab some oil and we can all follow your
Yes, yes.
demonstration.
We will plan and we will do in the middle of the workshop. I will
Yeah.
also change the angle, and after that, one break, we can start all kind of demonstrations
We'll all
altogether.
be too rested then to listen to you once we finish oiling our feet. So we'll wait till a little bit more time and then we will all fall asleep. Huh? Yes, Bhakti Dasi ji.
Thank you. My question was around bloating, specifically below the rib cage to the lower pelvis. Can you explain why we might get bloating and our quote unquote stomach may be extended out? Thank you.
Yes. Yeah. Thank you so much. Actually, this is very important, and day to day, we are all facing this kind of bloating trouble. Firstly, we have to know which kind of lifestyle we are following. If we are having the so much sitting and no exercise zone, the bloating can be normal because of the indigestion. Secondly, in Ayurveda, Vata Prakop is mentioned because of the overthinking, bloating is highest. When we overthink, because indigestive food material is in the upper portion of the intestine known as Amashaya. Ama means half cooked, and Ashaya means the area. It means the home of that half cooked area. So when we say half cooked food, we are not able to digest because of the overthinking and stress and continuous constant thinking. So sometimes bloating is more there. So the easiest way of removing the bloating is to do the Nabhi Abhyang. Nabhi means your umbilicus and oilation there continuously. So that can be the easiest way to remove the bloating. But the most important thing is, as you know, the bloating is because of your overthinking, not because of your stagnant lifestyle. We should try to do Om Brahmari Prakriya as well as some Yogasana, which is actually helping you for removing your overthinking process every day. So sometimes we give Tratak also, and Tratak is also working so much because sometimes because of the lack of concentration, because of the so much confusion, people are actually following in the bloat. They are having bloating, and they are not able to understand why I'm suffering from bloating. Second is so much stagnant lifestyle, continuous sitting over the in front of computers and doing so much work in stagnant place. Bloating is the second reason. In that case, we have to ask them for the proper and multiple asanas malasanas also and nakasanas also. I'm not expert of yoga, but I can understand that this asana will also help. In Ayurveda, we suggest the Basti treatment for the long-term bloating patient. Basti is nothing but the proper oil enema and decoction enema, which is selected on the basis of the biotype and condition of the patient. And by taking very less enemas, medicated enemas, we are getting so much good result in the bloating because it is working on the gut and brain axis also. So suppose you're having problem because of the overthinking also, Basti is working. And suppose you're having indigestion and stagnant lifestyle, we give some kind of lifestyle changes. And suppose if nothing is working, then change the food timing. 10 o'clock in the morning, try to take complete food, and 5 o'clock in the evening, try to take complete food. So that is the easiest way to remove the bloating for the permanent level. But most of the patient which I observe is because of the excessive intake of the medicine and overthinking. This was the two major reasons of bloating, which I found.
Oh, that's
Thank
fascinating.
you
That
so
is,
much.
yeah. Thank you, Bhakti Dasiji. What an incredible question. And what an incredible answer. So overthinking. Wow. Okay. But inflammation wasn't necessarily only because of overthinking. That's something to take home, ladies. Right? And uh, we'll have to ask you a little bit about what does an ideal routine look like. You've just started talking about it. When might one eat, when might one, but we'll take a few more questions first. Jnana Lakshmiji, your question is next.
Thank you, Doctor. Very informative. I'm a full-on fan of Ayurveda because I've just had some treatment and works wonderfully. I just want to ask you about you were just talking about the oil, right? The sesame oil you said for the,
Yes.
now, so when you're in India, with the weather consistent most of the time, it's great because the oil temperature, and overseas you get winter and summer seasons changing. I try and put some on my head to cool me down, and it flares up my nasal. So is there, I don't know, any idea that you have that you do it only in summer and not in winter, or how do you manage the winter heat?
Yes.
So, sorry, can you hear me?
Yeah, actually, in between, I was not able to hear you. I'm so sorry about it. But
No,
But I think
that's
we
okay.
captured.
Sorry.
I think
What
we
I
got
was
the
saying
gist of the
is,
question.
okay, can you hear me now? Or
Yes,
can
I
you hear
think
me
we got
better?
the gist of the question.
Okay, all right. Sorry about that. So, like I was saying, so you were talking about applying the oil for the feet, right? For the feet so that you'll get better sleep. But can we also apply some for the hair to cool yourself down? Right. So,
Yes.
but in winter, I find it's a challenge because, yeah. So, is there any, do you have any suggestions for that?
Yes, I'll tell you. So actually, very nice question. But the thing is this: the Shiro Abhyanga. It means Shiro means your head, and Abhyanga means the oilation of the hair. Shiro Abhyanga is not mentioned in everyday routine in Ayurveda also. So in the season wise, when we say we have to apply hair oil in winter season, better to apply the Ashtotana. Ashtotana means the Nasyam and Ashtotana. Nasyam means the nasal treatment. The sesame oil you should put in the nasal area. And this you should rub and very easily you should apply so that the balancing of the scalp area can be done very easily. So it is not necessary in winters you have to apply the hair this oilation. That is, Shirobhyanga should not be done in everyday basis. And suppose you are so much keen and you want to do that, then you have to change the oil to mustard oil a little bit, and that can be applied. But the thing is this: it again depends on your body type. If your body type is having so much fire, then the mustard oil can create some problem to you. So that's why I'm suggesting the nasal treatment and nasyam in the nostril with the help of simple sesame oil will also work more in that case. And you can sleep in a better way. And that the oil which will go in your this neck area, it means inside the like when we put nasal drop, so that we have to be careful. Only one nasal drop in each nostril we have to put, and we have to rub it like this. So it is known as pratimarsha. Pratimarsha means every day you can use that nasya treatment. In Ayurveda, as a treatment, it is known as Marsha treatment. Marsha means 8 drops we have to put and we have to detoxify it. So that's a different way and different treatment way. But when we have to self-care, just we have to apply one drop of sesame oil, and we have to rub like this very slowly. And after that, we have to give the gentle massage in the face area. And then
Okay.
the Ashwagandha, which I was talking about, it is about the eye drops. Eye drops
Yeah.
is there in Ayurveda, which can be used for again for the good quality of sleep. Along with the foot massage, the this eye drops as well as the nasal drop can be applied. So it can work in all the seasons. I hope I can satisfy and acknowledge your question.
Thank you, thank you. I think you did great. I will try definitely and let Akanda know that. Thank you. Thank you.
Thank you, Dr. Prashantji. That's a wonderful answer. We have a few more questions here. Wenkiji, I think you're up next.
Namaste. Thank you so much for sharing all your wisdom. It's so lovely to be listening to the both of you. I have two questions. Two of my main health concerns at the moment are two diagnoses that I received. One is lip edema. If there's any knowledge, any Ayurvedic knowledge, treatment, ritual support that I can add. And the second one is post-viral fatigue. If you have anything on that. If it's not too specific, I would appreciate it. Thank you so much.
Yeah. Thank you so much. Thank you so much, Venkiji. And this is very specific question, but I will love to answer that. First question is about the lipidemia. Lipidemia in Ayurveda, it is known as Medo Roga. Medo means internal and external fat deposition. Internal fat deposition, if it is inside, it is known as lipidemia in that case, in which inside the vessel, fat is deposited. So in Ayurveda, we have to do very easy ama pachana. Ama means the toxins inside the vessels, and pachana means the digestion. Simple herbs are mentioned in Ayurveda. You must have heard about so much about tripla, three main herbs like tripla. So much like extensively available all over the world. So that should be taken 10 o'clock in the morning and 5 o'clock in the evening. 1 tablespoon just before food, because that in Ayurveda it is known as chronopharmacology. Chronopharmacology means the timing on which the body is designed and the where we have to work, and herbs will go in that same direction and it will go as a lock and key mechanism. And we have to reduce the lipidemia. So first of all, we have to work on our diet, like because it we when we think we are very thin and still we are having the lipidemia problem, it means the fat is not depositing on the external level, it is depositing on the internal level and micro level. So in that case, we have to work on our diet and we have to be very careful on the basis on the timing of sun we should eat. 10 o'clock morning and 5 o'clock evening. These are the true ahar kalam. Ahar kalam means at the time when we take the food. It is mentioned in Ayurveda that we have to, if we have to work on lipidemia, we have to work on the food timing. And before starting the food, we have to start with the tripla, not by the end of the food. But if you are taking by the end of the food, the channels are different. When we take starting of the food, that is known as apanakana, and digestion can be done in a micro level. So in that way, we are taking tripla in both the times before food, and quantity is 3 to 5 grams. Then it is working in lipidemia. I'm just telling you the treatment as a general, not as a specific. General line of treatment, how tripla is working, because lipids are having slimy and sticky in nature. So tripla is having dryness in the nature. So when we do the opposite treatment, it can balance the our 5 element theory. So when sticky substance is very high, we have to give the dry substance, but it should not create extreme dryness. That's why tripla is preferable. Second question is about. May I repeat the second? Please, can you repeat the second question?
Yeah.
Post-viral fatigue.
Post-viral fatigue.
So actually, it depends. The post-viral fatigue in Ayurveda is known as jwara, jwara chikitsa, jwara dushti. Jwara means when mind, body, and your senses, both are irritated, it is known as jwara. Jwara means the fever, any kind of fever. When post-viral situation is there, it is more fatigue is there, in which micro level cellular system is damaged. So how to regain it? It is very easy and nice way is mentioned to start with cow's ghee to remove the fatigueness in a micro level. When we take the A2 cow's ghee, so micro level like digestion can be initiated and fatigue can be reduced very quickly. In Ayurveda, it is known as Ghritapanam. Grit means the cow's ghee or ghee butter, but it should be of A2 or Indian desi cow, and it should be prepared in a Bellona method. That is a specific method to create the ghee of such level which can nourish the micro level of cells and micro healing. That is the only like food way. Second way is how to reduce the fatigue in the post-viral way. You should do the Abhyangam treatment, that is known as whole body oiling and self-oiling in a slow way. And left lateral, you should sleep in the left lateral position to recover it. That is known as Vama Kukshi Swapnam. Vama means left, Kukshi means left lateral side, and you should sleep and try to recover yourself. This kind of recovery will give you very quick result in the fatigue, like reduction of the fatigue. And suppose you are getting post-viral fatigue for 10 days, by doing this, you can reduce the timing to 3 days. I have experience because right now you can see me as post-viral and post-dengue fatigue. From last 5 days, I was suffering, and when I was in Korea, and I took only Ayurveda treatment, the Chandrakala Ras and the Kamduda, only 2 tablets, not any medicines, and I came from directly from there, and I'm still in the OPD. So that is a way of healing with the help of Ayurveda. So it's working so well. So that's why I can say by my experience also.
We had no idea, Dr. Prashantji, and we might have rescheduled this if we had known. But I had the fortune of seeing Dr. Prashantji after having dengue and typhoid myself last year. And I normally don't approach Ayurvedic doctors, but I was really concerned because my hair was dropping rapidly post-viral. And it was really helpful. I came out of my denial of being pitta. And I also tried some really, really nice medication that is actually Dr. Prashantji's wife is Dr. Jaya, and
Yes.
heads up Dharma Ayurveda. They produce medications, beautiful combination of medications. There's lots of Ayurvedic, quotation marks, medication out there. And then you're really not sure if it's got authentic materials. Does it actually do anything? So he gave me some tablets for my hair loss, and it worked, guys. I still have my hair. And it really helped with post-viral recovery, post-dengue and typhoid recoveries. Thank you. And maybe we can share a little bit about those things onto the chat box later. And for those of you, because Dr. Prashantji is going to be the overseeing Akhanda Ayurveda will be operating out of Prakash Yogashram, which many of you are already very familiar with, and also Jungle Ashram. So the way it will work is there's the inpatient concept where you come and stay at the ashram, and Dr. Prashantji and team take care of your support, treatment. Ayurveda is very unique to your specific circumstance and constitution. But we also have asked Dr. Prashantji, can we have I say a couple of different types of consultation. First is online consultation, because not all of us are going to be able to make it to Rishikesh easily. So Dr. Prashantji, can you share a little bit about that? How would an online consultation work? If someone wanted to do that, yeah.
Online consultation, in that case, like Venkaji suddenly asked like about the specific situation. So firstly, why we are not answering so much specifically, because we do not know exactly your body type right now. So on the basis of body type, which is known as Prakriti, your Prakriti and how it is disturbed. So that is a very essential and important portion. So when we do the online consultation also, so we are having some specific questionnaire about it. And that really works, because somebody asked me in like because we do Nadi Parikshana also. But Nadi Parikshana is only one of the tool of diagnosis. But other than that, we are having two different and very important way. It's known as Darshana and Prashna. It means how we can see that patient and what kind of questions are relevant, and scientifically we need to diagnose that patient, and how is the body type. So that kind of body type questionnaire we are already having, which we use for the online consultation in many countries, and it is working so well. And online consultation, we are going to start in Akhanda also as a family Vedya and as a specific Vedya, as a Ayurveda mentorship for each and every one. So that people can ask their specific question. First, we'll understand their body type. And on the basis of the body type, what are the disturbances are there? And we'll give the specific line of treatment, which they can do, first of all, how they can change their lifestyle in day-to-day basis, what kind of things they can take in the day-to-day basis, which kind of ritual they can incorporate in their country with the available sources, as well as in the end, some kind of medication which is extremely important that can be prescribed and that we can give and we can send in their particular country. Right now, we are like giving consultation in 21 countries, and people are so much satisfied because our way is, firstly, we understand the body type, and on the basis of body type, we understand which kind of deformity or kind of this like imbalance is there, and on that imbalance, we give the specific lifestyle changes, dietary changes, and medicinal changes. These are the three way we give the, and so we are very happy, and as a part of Akhanda family, we are able to connect more people in the different countries so that they can take the benefit of Ayurveda, and they can live life in a better way and more scientifically. That is our way of thinking.
That's fantastic. So there's this will be online consultation ability, and then these two new cool things that Vishwaji and myself really wanted also to have at Akhanda Ayurveda is the concept of a family doctor, right? So it's a person that you can always go back to, and who's an Ayurvedic doctor, and that you might check in with as your body changes and grows over time. So that's one. And then the concept of a family doctor, that you can actually have a family consultation. Those of you who have teenage kids or a husband who's not too into Ayurveda, things like that, you might really enjoy this. That you might actually go as a family to an Ayurvedic online consultation and have a look at how does that, because that was the reality of what many women had to deal with, is their dosha type is there, but then also how they're balancing within a family dynamic every day. So we maybe we can put in the chat box, Sauravji, Palakji, we can put in the email address that people have to can email if they want to. Yes, thank you, Palakji.
Every day, our Ayurveda doctor will take their whole details, and they will help as a family, because when we know the body type of each and every family member, so that is a actually beautiful concept of Ayurveda, how to balance the life in a scientific way. It is not only about the disease. It is about the emotional grounding. It is about the sleep pattern. It is about the food pattern. It is about the seasonal change. Many things are there which we can discuss. In modern doctors, we have to discuss only about the illness. But in Ayurveda doctors, we are not talking about the illness. We are talking about the wellness. We are talking about the day-to-day life zone. We can talk about our skin, hair, and everything, our digestion pattern, bloating only, not having any disease, but I'm feeling this in this particular season. Small things can be discussed. My whole family is of modern background, and all most of the family members in my family are allopathic and modern science doctors. So they are only asking about their wellness, what actually we should do and how to change in this season. Suppose I am having so much anger issue, what I should eat and I should balance it. This is a very fantastic question they always ask. Suppose I am very angry on my colleagues and my working area, so what I should eat. So I said you should eat date, because when dates are the balancing thing, when we take the dates, your pitta can be reduced very specifically. And when you are angry, at the same time, when you take the date also, that is a scientific conversion, that this date is given to reduce the pitta, and that kind of psychological training always helping the patient. In my Dubai patient, in Qatar patient, they all are having anger issues, and they are taking dates and they are getting so much good result out of it. So I tried with these patients, like 50 patient I started. Then I tried in this kind of same things in my South Korean patient. They never tasted date before that. When they started tasting date and they took this thing in their anger to manage their anger issues, they also gave me the positive feedback that it is working. Because South Koreans before not like they don't believe before testing like for 5 times, 7 times, 10 times, and after that they are having the documentation sheet and they said, "Oh, I tried this 10 times and now I can say it is really working." So this kind of experience I'm having, small things. So Ayurveda is actually the science of life. It is not about your illness. You can enjoy the life with the help of Ayurveda every moment. Suppose I'm when I wake up, I'm pushing I'm doing the brushing with the help of Ayurveda toothpaste. So I'm enjoying that, but because the secretions are changed and herbs are healing also, scientifically they are working on my teeth also, and I'm just doing that brushing. That is only a scientific way of life, simple way. I'm doing the tongue scrubbing, and why I'm doing it. And when we see the scientific way of why we are doing the tongue scrubber, so which which mineral I am using for the tongue scrubbing, and it is having giving me some health benefits. So it's a simple way, and it is giving me health benefits. So this is a scientific way of life. So that is the easiest way to understand how to live life in a beautiful, in a joyful, happy, peaceful way. And scientifically, we know about it. That is nothing but Ayurveda. So every
Beautiful.
moment you can enjoy Ayurveda.
Thank you, Dr. Prashant. Yeah, I think dates for anger. I'm going to put that onto the fridge as a reminder for myself, of course, only. Um, so, Jackie G, we have a question from you. And then after these two questions, Jackie G and Hannah G, I think if we have some oil nearby, we can grab some oil and then have Dr. Prashant Ji demonstrate to us the motion and way to do self Abhyanga before we continue with questions. So over to you, Jackie G.
Good morning. Namaste. Thank you for taking my question. So I've been reading and hearing a lot about the use of hormone replacement therapy as women are coming to the perimenopause age, and using it as a preventative way against bone loss and for heart health. So I wanted to just get your thoughts on that. I typically try to steer away from taking medications when I can, but it seems like with the studies that I've been learning about, like if you do take hormone replacement therapy, it can lower your risks of heart attacks by like 50%. So I just wanted to get your thoughts on this, please.
Okay. Actually, this question, same questions as everybody is asking all over the world in the perimenopausal conditions. Like most of the patient which I'm having in the database of 40,000 patients, and out of that, when all female patient I'm seeing, they are all asking about the perimenopausal situation. Answer is very specifically but very differently given in Ayurveda. Firstly, we have to follow the daily rituals on daily basis, like Nasya treatment and Kavala treatment. Small rituals are there, which I'll tell you in details when we do the specific ordination methods also. First is daily ritual method, which is very easy and you can enjoy the daily rituals from morning to evening. Only you just have to modify a bit. So perimenopausal females are getting like so much healed and they are getting so much benefit with the help of only small rituals known as Dinacharya treatment. Dinacharya means everyday ritual treatment. There are 10 small rituals by putting the nasal oil, by putting some hair oil sometime, and oil pulling methods and oilation, self-oilation, But most important and specific treatment which I am giving to my patient in India is Basti treatment. Basti is nothing but because all modern science are working mostly on their oral route treatments, where by taking the pills, by taking the hormonal segments, by taking the injectables. But Ayurveda was highly working in the perimenopausal condition with the help of anorectal route that was known as medicated enema therapy. It is known as Basti Chikitsa, medicated enema therapy. With specific herbs, we are having the absolute balancing of the hormone zone, oilation zone, like a lubrication zone of the joints, strength of the spine, as well as uterus, as well as some portion of the micro level of the cartilage, like when we see the knee area, this cartilage, the basic cartilage can be like lubricate and can be healed with the help of such kind of herbs. So that Basti treatment is very wonderfully explained in Ayurveda, and that should be taken for 8 to 16 days and 30 days only in the perimenopausal condition. And by taking only for 8 to 30 days treatment, we are getting so much fast and permanent result in perimenopausal hormonal balancing. The change of the like when female patient of my South Korea are taking 8 days treatment, and after that they are saying how we have changed so much, and we are feeling so much light and balanced, and we can like now we can work also, and we are not getting fatigue also. So this is, I'm not saying only, but what I found with the help of Basti treatment at perimenopausal situation, I will definitely recommend everybody to take the Basti Chikitsa, but it is not available if you're in your country, then you can go for the daily ritual methods. Or if you can get some time to come to India and you can experience this Basti treatment for 8 days, you will feel the huge difference in your complete conditions of hormonal balance, perimenopausal situations, head to toe changes you can experience, gut brain axis balancing, everything you can do only with the help of Basti Chikitsa. I'm not getting very like pushy in that way, but I'm telling you this is a miraculous treatment which is mentioned in Ayurveda, and Basti is giving the wonderful result in every individual, not only some individual, every individual. This much specifically I can say because that is the only best treatment which is recommended in Ayurveda.
Thank you.
Thank you so much, Dr. Prashantji.
I hope to see you in Rishikesh also. You can come and
Yeah,
we can experience this treatment.
and on that segue, just before we drop off to Hanaji's question, um, will if someone was doing these sorts of treatments, Basti, etc., is it something that they do once a year, a couple of times a year? How does how does that work?
Actually, for perimenopausal situation, once a year, only for 3 years, that is sufficient. Because I have made one SOP, standard operative procedure, for the age of 41, 42, 43, 45, 46, 47. These are the age from 41 to 47. We are giving this treatment, and once in a year is sufficient for that. But when we are going for the well-being and reverse of aging, so in that it's also Vaya Sthapana. Vaya means your age, and Sthapana means to secure that age, to stop that age. This is also mentioned in Ayurveda, Vaya Sthapana treatment, 2 times in a year by the season change, especially in the month of September and October 1, and especially in for February and March, in according to Indian subcontinent situation, if we are taking, this is known as Vaya Sthapana treatment. And I'm telling you, all kind of like movie star and these people, they are taking the 2 times treatment for the Vaya Sthapana. How to balance it? Prakashini ji can definitely connect this thing. The South Indian star Nagarjuna is taking 2 times in a year, and you can feel how he balance and stop his age. And now also, when I saw him in 1991, and till now, he's looking same. You can definitely connect this. I guess Diksha, you can also connect this thing. So that is actually because of the Basti treatment, and this can be done, and I'm very sure about it. And you
I was
can
going to
feel
ask,
that
what is
kind of.
Nagarjuna's wife taking? Amalaji is looking pretty good
Yeah,
too. So,
no,
maybe
they
they're
are all
both
following the Ayurveda treatment.
maybe they're both
Yeah,
doing it.
yes, yes. They are highly like so much pro Ayurveda people. They both are.
Right, wonderful. Okay, so over to Hannah ji quickly on her question and Diksha ji, and then we will try asking you about routines and boiling.
Okay, thank you so much for taking the time to answer my question. And it's related to the previous question. So I had breast cancer, and I also work with women who've had breast cancer, and we no longer produce estrogen, or if we do, we take medication to prevent estrogen being absorbed by the body. So we've all gone straight into menopause. And I'd love to be able to go to them with a simple, general ritual that they can do, that we can do. Maybe I can teach them it that will help them get through it. Because we can't have HRT, we can't have anything, any supplements with any estrogen at all.
Yeah, very nice question and very important question for the whole globe, not only for the particular country, but I think whole globe is suffering from, and many females are suffering from this. So what we actually Ayurveda is having a wonder drug known as Shatavari. Shatavari is a beautiful drug which is actually helping in the natural estrogen level to actually creation of that, as well as like you can take the nasal treatment, one drop of the Shatavari. Shatavari oil is also available. Shatavari cow's ghee is also available, medicated ghee. That we are using in our all Indian patient for the who are suffering from the breast cancer. So, like most of the patient who comes to me and they are having history of breast cancer, I am giving them Shatavari, only one nasal drop, as well as the foot massage, as well as the hand massage, and the breast massage of that particular area can be given with the help of like Shatavari. Shatavari ghee is available. Shatavari and medicated ghee with the help of Shatavari. Shatavari is a kind of herb which is actually having the natural resource of the natural estrogen. So that is actually working so well. But people who are not comfortable with the oilation method and daily ritual method, we are having granules of Shatavari, which is available like most of the Western countries also nowadays, known as Shatavari Kalpa. So that can be taken in the at the end of the food, half tablespoon at the end of the food, but don't take it with the milk because for the general well-being they are giving with the milk. But for the specifically for the breast cancer situation, it should not taken with the milk because it can create some bloating. Because and most of the Western people are not having that understanding to take with the milk because mostly they are having sometimes the lactose intolerance is also there. Many things are there. So I am suggesting you to take the Shatavari in the half tablespoon just after the food. So that is the second way. Third way is the when you are not having anything, then sesame oil nasal treatment should be given for 60 days constantly to initiate and help in that way the axis, the brain axis and the estrogenic axis can be balanced with the help of nasal treatment known as Nasyam treatment. Nasyam means only nasal treatment, one drop you have to put sesame oil and foot massage and hand massage known as hastabhyangam and padabhyangam. Hand and foot area are having the directly the this kind of like stimulation point. So that is actually helping so much in the case of breast cancer patient. I am giving this treatment to every breast cancer patient in my South Korea clinic, and they are getting so much benefit with the help of them, especially the kind of mood swings and the like depression this also is going. Secondly, the natural estrogen secretion is increasing up to a certain point, but in some cases it is not working when the patient is having grade 4 breast cancer and repeated repetition of that. In that cases we need shirodhara treatment, so that because of the some stressful situations and commonly when they overthink, this kind of situation can also occur, and we have to give shirodhara in that particular cases. But that needs some kind of assistance that you cannot do by your own. That's the thing.
Thank you
I
so
hope I am able to acknowledge that. Right, like it is okay.
Thank you so much. Thank you.
That's such a beautiful thing you bring up, Hannah-ji. And I would love for anyone here, anyone watching this recording, if there's a particular kind of area that you would like to learn about, you would like to have either online or in-person training on that, I'm incredibly in awe of how much wisdom Dr. Prashant-ji brings. We went straight to PhD level. We didn't ask him about daily routines. We started asking about individual disorders and individual concerns. So the other day we were speaking to our marketing manager. I said to her, I want to have, like a yearly Shakti Wellbeing retreat at the ashram where you spend 10 days, ideally during Navratri, where you do Shakti sadhana, but then you also get self-care and support for the physical body and support for taking care of yourself and your radiance. And so I was keen to have something like this because I deeply need to go to those things too. And so on a very selfish note, I said to her, can we book some dates? And she said to me, Prakashini, do we need to have dates for that? Can we not have that available for Shaktis all year round? They can book and come and do that. And it was mind-blowing. I was like, why not? So we gave this to Dr. Prashant-ji. We will also highlight the Navratri dates for that as well, to even more Navratri sadhana. But so much of yogic tradition is to honor this Shakti energy and to honor and cultivate and respect it. And so Dr. Prashant-ji will be running, I think it's 9 or 10-day type Shakti programs that will help reset the body, the mind. A few of those topics came up around overthinking, a few of topics around physical body self-care. And we will do the Agnihotra Chikitsa and yoga Chikitsa to help reset the body on all levels. But on that note, we would love it, because I know we went straight to sort of PhD level. We would love it if we could have some idea of routines for the day, especially if you're short on time. What are the things that you can do every day that help bring balance and, as you said, the experience of well-being or wellness into your life? I imagine the dinners at your house with all these allopathic doctors and then yourself must be really interesting conversations to listen to, of the differences of opinions. So why don't we, if you have oil nearby, Dr. Prashant, is there any oil that they should not use, or is it fine? We haven't given them.
Sesame is the most convenient oil. Sesame oil is the most convenient oil. Secondly, if like I don't know the seasonal situation, most of them are experiencing the summers, or it is winters in some places.
I think it's mostly summer for people on this screen. So yeah, it'll be summer. Yeah.
Okay. So actually, if it is winter, then mustard oil can be used, but not other than that, because the sesame oil can be used in all the body type. I just want to add one thing when you asked about the Shakti, like balancing way. Ayurveda is having three dosha, Vata, Pitta, and Kapha. So three days we need to like balance it, and 1 day to understand the body type. So 10 days if we give for the Shakti like a healing way. So the Basti treatment can also be planned, and the rejuvenation can be planned. The understanding and why they are doing that, that all kind of explanation, and along with the body, mind, and soul balancing way, like with the help of Agnihotra, with the help of yoga, the body, mind, and soul can be connected all together, and we can like give this kind of experience to each and every individual, the all kind of Shakti, like all kind of female strength, to balance their hormone as well as their body type, as with the help of Ayurveda. So that can be done, and it's a very beautiful like a plan to do the Shakti rejuvenation therapy treatment for 10 days. So
we are so
and
excited about that. And for those of you, most of you haven't been there in the last couple of months during the sunny and monsoon seasons, but the ashram is having a facelift. And there's been some treatment rooms, some doctor rooms, some kind of interesting things happening in Prakash Yoga Ashram, so that you can come and immerse and get treatment, get support, self-care, all of that right from within the ashram, right near the fire puja area as well. So you're in for a surprise when you come back. I don't think anyone on this screen has been there in the last couple of months, so you'll see that. And then separately as well, for those of you who are not coming to Rishikesh but would like this support in your life, one, consultations, you can email Ayurveda at akhandayoga.com. And two, like what Hannah-ji mentioned, if there's a particular kind of this particular area, can we do a workshop series around that? If there's enough people who are interested, we are more than happy to put that on either on Ashram Online or as a separate series. Okay, so this is a space we really want to bring well-being into all parts of our existence. So let's take a quick 5 minutes to get some oil, some ghee. I think coconut oil and things like that is fine as well. I see that Neil Gangaji is on the screen.
Demonstration.
Not honey, Neil Gangaji, but ghee and oil, coconut oil. Yeah, very good. And then we'll come back here because I would personally also like to hear a little bit about what should that day routine look like, and what, if I don't have a lot of time, what should I do to help bring some balance back into my body, mind, and soul. Okay, so 5 minutes and we are back on screen here, guys.
We will do the demonstration of the Nasya treatment, and I'll tell you about the Kavala treatment, the oil pulling in a different way, and the self-oiling treatment. So quick view on these three things and some steps on that. And after 5 minutes, we'll start with that.
Okay, all right, 1 second, I'll just stop the recording.
think I'm visible. This angle is okay for you, everyone?
Okay, can you hear me now?
Yes.
Yes, we can see you, Dr. Prashantji. We can
Okay.
see
This
you.
angle is okay. Yeah.
Yes, yes, we can
Thank you
see
so
you.
much.
Can
Yeah.
I just
Can
ask
we?
a couple of questions before you start?
Yes.
In a Canadian kitchen, what we have is these oils:
Okay.
olive oil,
Olive oil, yes.
avocado oil,
No, not for the external use.
not for external use. All right, everyone listening to this, um, ghee,
Can be used.
okay, and then argan oil.
Yeah, that can also be used.
Argan oil. Okay, so if you're listening in on there, if you had avocado oil in your hands, put it away. Uh, coconut oil. How about coconut oil?
Yeah, coconut oil also can be used. If you're having so much oily skin, coconut oil will work. And if you're having very dry skin, olive oil will definitely work. And when you're having the so much hot flashes and you feel that body is having heat, so much heat, so that time ghee can be used. But the people who are like they don't like the ghee smell sometimes. So that time also we give the alteration at like a second option as the olive oil can be used in that cases.
Beautiful.
But
And
what I
jojoba oil.
prefer as
We have a jojoba oil. Is that right, Hannah ji? Is that?
jojoba, yeah. Jojoba also I am using in South Korea for the patient sometimes. But sesame is working so much well. Sesame is available in Canada. It is
It would
available.
be. It's just not. It's not a regular buy. We often get in the regular grocery store roasted sesame oil. So you guys have probably seen the little bottles of roasted sesame oil, which we use in Asian style cooking often. Um,
Okay.
roasted sesame oil has a very strong smell, so that's not what Dr.
You can
Prashant is
see
talking
the this photograph.
about.
This yeah. So I
Mm-hmm.
am having Abhyanga oil with me, and it is having the base of sesame oil and some kind of herbs also. So
Okay.
this is known as Abhyanga oil, which we are using every day-to-day basis.
Okay.
So secondly, like if you're not having Abhyanga oil, it's okay. But I always suggest right now I'm using this. You can see it is visible.
Ah, yes. Okay.
That kind of things that fire should be, and that it is known as this simple things, and lighting the this thing, and
Okay.
some kind of aroma. Why I am doing this? Because we are balancing the five elements all together.
Mhm.
So somehow the gandha means the fragrance, and the fire should be also there. So
Okay.
that is the balancing way.
So
So
some
when we
kind
do the
of
sandwich,
aromatherapy
yeah,
plays a role, and then some kind of fire element of Agni is present too. Wonderful.
that
Okay.
is yeah, that is only the way to like make ourselves heal in a very good way.
Mhm.
Because every day you cannot do that, but if you can do like in 20 days in a like a month, then also it will work a lot. So I am using here the sesame oil based Abhyanga oil,
Mhm.
and I will give you the demonstration of Padabhyanga in a simple way.
Mhm.
Because Padabhyanga generally we don't get this demonstration, and we do not know how to apply the Padabhyanga like a foot ritual way. So because when we every day we can apply this thing, sometimes we cannot apply the whole body oilation. Whole body oilation we can apply on the basis like weekly basis or 2 times in a week, because when we get the time we can do. So I'll tell you some steps of how to apply the oil in the regular base also, and like foot area like Padabhyanga. So I'm visible very properly.
Yes, you are.
So easiest way is, firstly you have to take out the oil in the palm area and you have to rub the oil in the palm area so that the oil can be absorbed very easily, and you should not use so much oil in the first day. Then you should use the Padabhyanga, and the foot area should be placed like this in an easy way, and simple general smearing, like only application of oil in any of the direction. It is not having any specific direction that you have to go in that way. Firstly, smear the oil all over in your foot area so that it can be lubricated and you can start the procedure. I am visible very properly.
You are. This feels very luxurious already. For some of us, putting oil on our feet in the morning, it's quite the pampering
Yeah,
thing.
yep,
Yes.
yeah. For you morning, and I am doing in the night. So try to prefer this in the night ritual
Okay.
also.
Okay,
This is
sure.
one of the night ritual, and
We
in
will
the
try it.
morning ritual, just before the bath also you can do that. Second step is this. Again, you have to take the oil in a little, like a more quantity, like little more quantity, and you have to start the smearing from the from the calcaneum, from the base of the foot to the toe area. In this way, please understand, you don't have to go from the toe to downwards. You don't have to go. Just you have to go towards the toe. This is very important.
Heel to toe. Okay.
Why so? Because we are having five like type of vayu, in which we have to balance and we have to make the alignment. That is known as vat anunomana. Vata means five vatas are there: pran, udan, vyah, saman, and apan. Five vayus are there. So out of that vayus, we just have to balance it. So we are just doing the balance, and we should not go in the downward direction. We just have to go towards the toe. That should be done. So we have made one SOP to remember, each and everybody can remember. So 21 times, 7 times for each dosha, Vata 7 times, Pitta 7 times, and Kapha 7 times. 21 times you can apply this very easily.
Do I
So
need to make a
21 times.
sankalp in my mind about each dosha? The sankalp.
Yeah, that can be done. Yes. So for like 21 times, if you do, so it will be easy, and you will able to balance it, and you can able to remember it also very easily.
And I don't have to put pressure. It's just a light.
Yeah, for it, yeah. And after that, you have to do the like 21 times. When you finish, just you have to rub the like fit. You can see how I'm doing it. It is visible.
Yes.
This is an easy way, and you don't have to apply any kind of pressure during this treatment.
Okay.
When we end the treatment, then you have to apply some pressure at the end. It is not like before that. So I'll give you one SOP. Again, we'll repeat. Firstly, we have to smear the oil. Then we have to do the 21 times this thing. That is nothing but the balancing of Vata, Pitta, and Kapha. Then you have to rub this
From
21
side to
times
side,
like
kind of.
this.
Yeah.
Yeah, 21 times. From the toe side to the downward. You can do that. It is really possible, and you can enjoy this thing.
Yeah. So on the when I'm doing vertically, I'm doing up, but then when I'm doing on the side, I'm doing toe to heel
Down.
downwards, right? Okay.
And just after that, you have to give the some pressure at the end.
So interlocking the fingers and just putting a little bit of pressure on both sides of the feet.
Yes. Because that is known as samvahanam. Samvahanam means the very slow way of pushing the body. Samvahanam priti nidrakaram vishyam, which we have done in the pad area, known as padabhyanga. So padabhyanga means foot ritual, foot oiling. And lastly, we have done the samvahanam. Samvahanam means just pressure like this, small pressure. So when somebody can help you in this, it is better. But when we have to do, like, it is also not very bad feeling.
It feels very
So
nice
are you?
just doing it yourself.
So when we do it for more than 7 days now, you can feel the changes in your foot area. You can change the feel in your sleep. Not on first day, but on 7th day, like after doing it for the 5 or 6 days, you'll feel from the 7th day your sleep pattern is changed. It is more comfortable, more pleasant, and your like dosha can be balanced in a more beautiful way. Secondly, again,
There's
you have to
some
do it
good
for the
Guru
second.
Purnima week self-care for you guys. Guru Purnima week self-care. Every day you are going to give yourself Pad Abhyanga with
Yeah, that is.
not avocado oil.
It's a
Yeah. I have a lot of oil on me though. So I'll have to do this in the evenings. Yep.
yes. Nicole ji, you liked it? Because I think she enjoyed so much with sesame oil. Nicole, because she is having sesame oil, so she can enjoy it more in a more better way.
She's my we probably will have to go out shopping after.
So this 21 times when we do it for more than 7 days, you can feel like now the sleep quality is in a more lighter we are feeling, and the urine and motion control is more better. That is also mentioned because these are the points in which when we touch every day and we apply oil every day, we feel more lighter, less in fatigue, more energetic, and good quality of sleep.
Mm-hmm.
And in Ayurveda, when we say Vrishyam, it means more in the immunity. We are increasing the immunity by doing the small, very small ritual every day. So that is also a beauty of Ayurveda. By doing the small, small things, we can increase the immunity, we can reduce the fatigue, we can increase the facial glow as well as the strength. So that is nothing but the indirect way of healing Shakti in everyday basis.
I feel like my right leg and left leg are out of balance now. I'll have to do the left leg. And meanwhile, we have some beautiful aromatherapy ideas in the chat box. Maca and rose oil. Yes. Oh, that sounds wonderful.
Right now, I'm using the rose oil with this candle. So I can feel like because it is a little humid and like hot here. So I'm using my this rose oil in a better way. Wheatgrass also some people can use when who are having the depressive segment and kapha more. Wheatgrass oil also they can use.
Wheatgrass oil. Wow. Okay, I have not seen wheatgrass oil yet. And then we have, while we're doing this, I have a couple of questions that people are put in the chat box here that we didn't realize. Do you mind if we keep asking you questions while you're doing Pada Abhyanga? Or maybe you want to show some couple of things more and then we'll go back to the questions.
Now, actually, I want to show you like what daily ritual we are doing. Second is Nasya treatment. Just we have to like right now, sesame oil is with the Nicole ji, and I guess Prema Rupa ji is also having the sesame oil with her right now. But the thing is this, you need such kind of droppers with you. Or if you are not having any dropper, I'm telling you, you can start with single, like one drop thing. So that the ring finger you can use and single drop of oil you have to put there. And the nasal, like one drop only you have to apply in the lateral wall and the medial wall of the your nasal like lining. That's it. This is known as the pratimarsha. Pratimarsha means every day you can apply this one drop of oil in the nostril, and then only you have to do the gentle massage, only for 5 minutes.
So on this side of the nose and on this side of the nose, is that right?
Yes, yes. Medial side, it means the middle side, and the lateral side. These are the two walls in which the stimulation can be done. And oil is having the molecular weight which can pass the blood-brain barrier, and stimulation can be go up on the upper zone. So that molecular weight is there in the oil and ghee and this kind of oil-based things. And you can protect your nostril by from the many viruses also. So that's the easiest way to protect ourselves from the viruses as well as increase the immunity, facial glow, and relaxation every day. But
And
this
so
should
are
be
you
done.
just using one finger there? One
Yeah,
finger,
it's
two
2
fingers?
fingers.
Oh, like Gangotri Mudra. Okay, right. So we are going to do up and down in this kind of motion. Where Venkiji is asking, she has
And
Anutailam.
yeah, Anutelam can also work, and she can use it for 90 days, and then she should take the break of 10 days.
Okay. So not fully continuous Anutailam use, 90 days break, and then,
Because
okay.
it is a detoxifying agent, Anutelam. So if you are using Anutelam, then you should take 10 days break after 90 days, and you should use the ghee in there instead of Anutelam, just to protect it.
This is very relaxing.
And last, you can rotate it also.
Okay, yep. I'm
Then
using
you have to,
at the
yeah.
moment. And so I probably recommend some kind of aromatherapy addition to this because I definitely smell very ghee. I don't want to smell like a dosa when I'm going
And you should,
sleep.
yeah.
And then here, yep. So pulling across the eyebrows and then circulating.
Yeah. Firstly, you have to apply one drops in each nostril in the medial and the lateral wall of the nostril. Then you have to go for the two finger, the mudra which you said. What is the
Gangotri
name of
Mudra,
that?
yeah.
Gangotri mudra. So that Gangotri mudra you should do. It's a very nice and easy way. Second step is this. Then you have to rotate it. The nozzle rotation is there. Or that you also, if you want to remember the 21 set, 21 times you should do. And at the end, you have to go with the eyebrows. And last, you have to do the Shankh Marma. This is known as Shankh Marma. And this is the vital point, just to relax yourself at the end. So 21 times and 21 rotation clockwise you should do, and try to relax after that. And that is the sum of this Nasya treatment.
So just to get the Shankamarma right, it's not the temples, it's just above the eyebrow ending.
Yeah, it is eyebrow, end of the eyebrow, and you have to touch it here, like just at the end point of the eyebrow.
Okay. And then Hari Om.
Feeling better?
Yes. Yes, this feels nice. How are you guys doing at home? Who's got ghee on their face? Yeah, Nilganga ji, I am feeling the ghee too. Okay. Sure. So this method of putting into the nose, what is this called?
It is known as Nasyam. It is known as Pratimarsham. Pratimarsham means every day. Pratimarsha Nasyam. Marsha Nasya is that in which we give the treatment, and we give the 8 drops of oil, 4 drops of oil, 6 drops of oil in the nostril, and to detoxify yourself. So suppose you are having insomnia and early wrinkling. So for that we give the treatment. But this is daily ritual. So this is known as daily ritual and self-healing way. So you can apply yourself. Last is Kavalam, in
So
which
just before
Kavalam
Kavalam,
oil.
so Nasyam, when you're doing at home and you're doing generally without a doctor's supervision, 1 drop in the nostril each day. Just one, not 7 or 8. Okay, good. All right, off for the next one. Thank you.
because when we read in some text and Google, so we find that 4 drops, 6 drops, it is written. So we get confused what where the Prashant was telling only 1 drops, he's right or wrong. So I'm telling you this is daily ritual way in which you are self-healing yourself. So and that the treatment which is written is not less than 2 drops, 2 drops, 4 drops, 6 drops, 8 drops is mentioned. So that is only for the treatment's sake, and the on the basis of the body type and the situation, we give the particular oil in that quantity. That is known as Marsha treatment.
Beautiful. And can you, I think we've got someone asking, can you just sum up the benefits of this one more time so that they can take it away with them? Yeah.
Yeah, Nasya will be highly beneficial for the early graying of the hairs, early wrinklings, and suppose you are having anosmia, you cannot smell anything. Protection from the viruses from the nasal root when it is going. Secondly, the skin glow can be increased with the help of this, as well as eyesight. So this is Urdhva Jatrugat Vikareshu. Urdhva Jatrugat means supraclavicular area. The strengthening and the lusher increasement of the supraclavicular area, Nasyam is the most beneficial treatment.
Beautiful. Thank you, Dr. Prashant ji. And then we are aware that it's almost 9 o'clock, guys. So we are going to get Dr. Prashant ji to show us 1 or 2 more things, and we're probably just going to have him again for next month to keep going on
Last
this
thing,
very riveting
yeah.
topic. Yes.
Last thing I'm telling you, this is known as Kavalam, or it's a different way of oil pulling method. Oil pulling method, generally what we do, we take the lot of coconut oil and sometimes sesame oil, and we pour in the oral cavity in the mouth, and we hold it. That is known as Gandusha. Gandusha means oil pulling, holding. But Kavalam is the daily ritual method in which you just have to take the 10 or 20 drops of sesame oil in the lukewarm water, and just lukewarm water you have to take, and you have to gargle and rotate it. It is known as Kavalam. You just after doing the brush, the this thing brush or any kind of like dental paste. After that, you should apply the Kavalam. So Kavalam, 20 drops only sesame oil you have to use in 1/4 cup of the water, like lukewarm water you have to take, and sip by sip you should take, and you should gargle it. And then you can throw it or you can take it. These are the two methods. If you can throw it, so after throwing it, you will feel more fresh. But when you are taking it, then after that, you have to drink whole 1 glass of lukewarm water after the finishing of the procedure. And then it will eliminate through the motions. But actually, I am not preferring that method. I am always asking you should gargle and throw it. That's an easy way, and you will feel more fresh after that. So this is the simplest method of Kavalam, which is mentioned in Ayurveda just to increase the strength of the muscles of the facial muscles, mandibular zone, as well as the strength of Hanu. It means the speaking power. Suppose you have to speak for a very long time, then Kavalam is the method which will give you the strength to the Hanu. Hanu means your mandible, so that you can speak in a better way and fatigue can be reduced.
Right.
So that is good for the Prakashini ji as well as Diksha ji and all the people who are have to
I
speak
thought you were
also.
calling me a chatterbox, Dr. Prashant.
No.
I'm
For the
just-
orientation.
I'm good.
I'm also using it for the because I have to take many lectures back to back. So that is very good and beneficial for things.
Absolutely. So how long do each time that we're gargling?
Yes, that's a very good question. 7 times you have to do one in 1/4, 7 times. Like one time I have told you, second time, third time, and seven time only you should do. 7 times. Why it is important in Ayurveda? 7 dhatus are there. 7 tissue culture are there. Rasa, Rakta, Mansa, Meda, Asti, Majja, and Shukra. 7 dhatus are actually collectively, they are actually making our all the tissues. So when we remember this one by one, so actually we are taking the sankar to nourish each and every tissue. So that is the way to remember 7. That's why 7 and 21 we do. So 3 times for the Vata. So every time we are just rotating in that way so that we can remember the Saptadhatu and Tridosha. So that is the way why we are doing in this kind of standard operative procedure.
Beautiful. Thank you for sharing that. Is there anything else for today? Because I think we are going to have to be back for this as well. That you suggest for women is absolutely should do or should do at a particular time every day?
These rituals?
Now, is there anything else that you recommend for women that they
Yeah.
should do or try not to do, on each
Yeah,
day?
one thing which I always suggest, please try to sleep in left lateral position. That is the most important way, which we never do, and we never think that this is going to benefit. So this is the easiest way, and try to like relax yourself for 21 minutes, and that is the easiest way to relax ourselves. So this is Vama Kukshi Swapnam, Vama Kukshi Shayanam. Vama means left, Shayana, Kukshi means your abdominal muscle, abdomen, and Shayanam means sleep. So Vama Kukshi Shayanam is the very easiest way to relax yourself.
So on
Right
my
now,
left, sleeping this way on my left to
yes,
first
yeah.
relax the system. Okay. Okay, this will help the sleep issues we were talking about. Diksha ji, quick question.
Yes. So, namaste, Dr. Prashant ji.
Namaste,
We
Diksha.
have a question here. When we talk about the routine for women, could you please talk about the breakfast? Because sometimes we are so busy and the days are long, and then sometimes we don't eat breakfast. So, can you please talk about breakfast? Because
Is it
sometimes we don't
necessary or is
do
it
it
a myth?
because it's very important, but I think it is very important. But I want you to talk about it. Thank you, Ji.
Thank you so much, Diksha. It's a very nice question, but if we go very authentically according to Ayurveda, then we actually do not need to breakfast. We should take the food, the whole food, the 6 days in the 10 o'clock in the morning, and we should start the food with the sweet or any date. So this should be we should do. So we should start the food with date or resin in a natural sweet or any kind of fruit, and then we should take whole food. So the 10 o'clock, if we are taking food, this is Ahar column number one. Ahar column means Ahar means food and timing. Ahar column number one. And 5 o'clock or 5 to 6:30 if you are taking. 5 o'clock to 6:30 if you are taking, that is second Ahar column. Only 2 times if you are doing, then you are automatically doing the intermittent fasting, balancing the body, and following the cycle of the sun and moon. So that is the easiest way to balance the body. But we are having the wrong concept of 4 time eating and triggering the pancreas many times. But Ayurveda say if you are taking 2 ahara kala food, then you can balance your body in a better way. But still, if you are feeling hungry, then you should take some dates more, resin more, and try to take some cow's ghee with lukewarm water. That is the
So
only way.
fascinating. So dates, raisins, or healthy sugars, right? Healthy fruits. Prior to your meal, prior to your whole meal, and it's nicer to do that kind of post 10 a.m. for the body. And now before 10 a.m., we've already talked about coffee last time, so I won't ask about that. But drinks, hydration, anything before 10 a.m.
Yes, yes. Water you can take, hydration you can take, coconut milk you can take, but actually the not the food like the greens and the actual food we should not take.
Right. So in some way that kind of might fit with many women's routines that they're a bit worried. There's this kind of also for a while there, I think it was to sell cereals and things overseas. I know in Australia we used to always have this don't miss breakfast, at least have your Pop-Tart or have your Wheat Bix or something like this, which I'm sure were not good for you either. But the idea that if you miss breakfast, then, oh no, like it's not good for your system is not really held in Ayurveda. It's kind of have a proper whole food, but start with it's important thing starting with something that is of sweetness before you eat the whole food. Can you quickly just explain on the sweetness before we
Yeah.
finish up?
First, Because actually Ayurveda say when we make the Prakrit kapha means the actual kapha in the body, so that then you can balance the kapha, pitta, and vata all together. So vata can be pacified with the help of sweet taste, and kapha can be initiated by the sweet taste. And most important thing, the sweet is the only taste which can pacify the vata and pitta together. It can reduce the vata pitta together because that can create the hunger and more irritation and inflammation. And kapha initiation means prakrit kapha. It means the balancing of element of the body. So by taking only sweet, you can balance all vata pitta and kapha all together one time. So that is why they have suggested madhur rasam. Madhur rasam means sweet taste. Should be the first thing to take in in terms of food. So that
So
is
for
a
those of us who
responsible
are
collection food.
running for the chocolate cake and things like that, that's not what he's saying. Um, healthy, healthy sweeteners. And in fact, we were watching Dr. Prashant eat at the ashram, and you always you take a teaspoon of halwa or a teaspoon of gur, jaggery or something like that. It's not a huge amount of sweetness before you start, but just enough for your system to recognize that sweetness, and then you have your whole food meal. So what a fascinating thing. Very interesting to have explored this with you, Dr. Prashantji. And so today I'm feeling pretty oily and kind of feeling relaxed in one foot. I'm going to go finish my other foot after this. And thank you for those of you who are asking. I know there's so many more questions to do. So we will continue, if it's okay for you, Dr. Prashantji, for next month. We'll continue with the whole range of other topics on women's well-being. And in between, if you would like to have a consultation or you want to have some ideas around our Shakti Wellbeing retreats that are just being birthed, please email Akanda Ayurveda. No, ayurveda@akandayoga.com. Ayurveda@akandayoga.com. Okay. Many thanks
Somebody
to Dr.
asked,
Prashantji.
thank you so much. Somebody asked that Kavalam is good for the gum health. Absolutely, that is very true. Gum health, it is going to help for the gum health also.
Right. This is so amazing. Thank you so much for your time today and for doing this while you're recovering post-dengue. Best wishes to you. You have a lot of energy. 2 hours, you haven't faded yet. So thank you for spending the time. And we look forward to seeing Ashram Online people. We'll see you tomorrow morning, 7 a.m. with Krishna Muktiji on Bhagavad Gita chapter 5. So Hari Om. And we will see you soon.
Happy Guru Purnima to everyone. Thank you so
Happy Guru
much.
Purnima to you too.
Happy Guru Purnima.
Maharaj, Dhanvantri Maharaj ki jai.
Jai.
Head of Ayurveda, Guru of Ayurveda. Hari Om.
Thank you so much.